Hey everybody, welcome to another CCA's Beyond the Benefits podcast episode. I'm your host, Mark DeFee, and I'm the Vice President of Clinical Insights and Market Analysis here at CCA. And with me is Zoe Kobrin, our VP of Marketing. Hey Zoe, thanks for being here today.
Hey Mark, thanks for having me again. It's always great to be here.
Yeah, absolutely. And Zoe and I have both been in the EAP field for about 20 years. We are both clinicians who have done the dirty work of EAPs, and now what we do is help bring visibility and help benefits consultants, brokers, HR leaders, anyone within an organization understand the value of EAPs and how to maximize that value. And this is our 10th episode.
Is it? Oh.
Yeah, I didn't realize that the other day, or until the other day. Someone brought it up.
Yes. Glad you pointed. Oh, yeah.
Hey.
Our 10th anniversary episode.
It's our 10th anniversary.
Right. That's exciting.
And to be honest, I'm happy that we're getting this topic in within the first 10 episodes. Everyone right now is talking about the higher functioning employee, the worried well, and getting them, apps and mindfulness meditations. However, there are certain things that, you can't meditate away and you can't call anyone else to help with. There are certain things that only, top-notch, best-in-class EAPs can do. These are crisis events, both for individuals and organizations. How do you support companies when an employee passes away or, dies by suicide, or there's a domestic violence situation going on, or even just a threat of violence, because you can't really turn to your health insurance carrier. It's truly an EAP that can do these things.
Absolutely. It's like you said, these are the situations that are fewer and they're in between, but you want to be certain that if you are in that situation, that you have a really clear sense of where you can turn, and that they will provide not only timely support, but really appropriate follow-up and aftercare as well for individuals who are impacted, but also for the organization.
Absolutely. It is so crucial in those moments to have timely access to the right individuals, because not every clinician can do this kind of specialized management consultations. These are high wire acts that if a company gets wrong, can cost them millions. These are the moments that HR and leaders of a company remember, long past retirement. It's going to be the stories they tell friends and family. Oh man, I had this one employee who came into my office and said X, and I had to deal with it. Being able to support the crisis moments just as much as the worried well it is really what a best-class EAP should be able to do. And Zoe, I know you have so many moments like this. What's been your experience with these type cases in terms of you as a clinician, but also how it impacts companies?
So two things came to mind as you were talking, Mark. One is that just the importance of being experienced. It's sort of like almost anyone would prefer an experienced surgeon working on them than a brand new assistant, right, who hadn't done this before. And then it can't just be one person, right? That person is supported by a team. So it's who's providing that direct support, right, to the individual, and then who's supporting them so that if they need to call emergency services or call, somebody's family member or friend, or they need some assistance, like that they are supported as well. And unfortunately, I think what can happen sometimes is that EAPs hire clinicians right out of school, and they're in these environments where they don't have other people right around them who could provide that support. And that's very worrisome. So I think that, both of those things are very important to ensure when looking at EAPs.
And well, in that last part, when I was doing this consulting work, it was way before the pandemic. People worked in offices. I was in a little cubicle. This was so long ago that I had a wired headset, no Bluetooth back then. But I could stand up from my cubicle and go consult with another clinician who was specialized in these type of cases. And there was a whole team of us that we could, at meetings, consult with each other on, hey, staff this case, here's what's going on. And I can't even fathom doing that now in this work from home era, which makes it even more crucial to ask questions around how are these clinicians supported in these moments, because you don't want to be by yourself as the clinician doing this. You want someone else supporting you, not only from a how to respond next, but also just an extra set of hands. So the clinician on the line can stay focused, helping the company and the individual and not trying to multitask.
Absolutely. And I had the same experience as you. I was surrounded by other people. There were just always a team there. So yeah, definitely something to consider.
Yeah. But here's a good example of a case that I worked a number of years ago, but it highlights how you can't plan for these events. And a lot of times it is in the moment that people are making decisions they never once thought they'd have to make. And so this particular case, I remember it vividly. It was a Monday morning. I get a call from an HR director who's like frantic, who's, I'm like, hey, breathe, what's going on? Let's talk this through. And she says, a long-term employee just came into my office saying that her husband, who's a longtime manager for us, has been abusing her for 20 years. Last night, it was the worst it's ever been. And she would like us to help her disappear, basically. She has all the documents in her purse that she needs to start a new life because she's been planning this for a while. She's already talked to the domestic violence shelter. And they said, whenever you're ready, call us and we'll come pick you up. And what she's asking us to do is hide her in the HR area. We have a bunch of empty cubicles, put her back there until the van can get her, and then help her get safely in that van.
Wow.
I mean, think of sitting down at your desk on a Monday morning and having that come your way.
Yeah. Wow.
We start talking about options. And as we're talking, there's a knock on her door. And like, I could hear her do the, and she's not breathing. She's like, it's him. He's knocking on my door. And I was like, okay, let's just stay calm. We don't know what's going on. Let's just act like we don't know anything. And she put me on speakerphone and I could hear the man pop his head in. He's like, hey, so-and-so, how you doing? Just looking for my wife. It's her first break. So I just wanted to check in, see how her day's going. And the HR director is like, I haven't seen her. It was clear she was nervous, but she got through that interaction. She got back on the line. I had to kind of get her calmed down again, get her breathing again. And then we had to get to work with figuring out what to do. And so within a matter of probably half an hour, almost every C-level executive for this company, it was a manufacturing company, was on a call. And there was a team of lawyers on the call. And they were asking all the right questions, all the questions that people should be asking, company attorneys. Is this our business? How involved should we be? What are we going to tell the manager? His wife is just going to disappear from our property and we have no idea what's going on. Like, how are we going to do this? This doesn't seem feasible. And that's kind of the route the conversation was going until this HR director, almost like under her breath, was like, what are we talking about? And you could hear everyone kind of quiet down. I was just on the phone on a conference call, but the CEO was like, what are you talking about? And she said, this lady has been an employee of ours for 20 years. She has never spoken up until now. If we don't do anything, she might not ever raise her hand again and ask for help. And I don't know if I can be sitting at my house tonight thinking of her in that situation. And you could hear like a pin drop.
Yeah.
And finally the CEO was like, do it, let's get her out of here. And like with that, everyone jumped into action because it wasn't just they had to get her into a van. They had to get her into a van with nobody seeing her, because if even another employee saw her, they'd go to the husband and be like, oh, hey, I saw your wife get into a van. What's that about? So they had to craft a reason for the COO to stop a gigantic manufacturing floor and bring everyone to one side of it for an emergency meeting so the van could pull up to the other side and get her out. Like you can hear me getting,
Wow.
kind of choked up because we were flying by the seat of our pants trying to figure out what to do next. And the company got her last paycheck in cash. They got her into the van. She disappeared and was gone from her life within, a couple hours on a Monday morning. And I stayed connected to the HR director after that, but they needed guidance in that moment of what to do. And if they hadn't have had an EAP that had this level of management consultation, I don't know what would have happened.
Wow. Gosh, yeah. Yeah, I'm really emotional hearing that, Mark. And I think what really just stands out to me is how, really quality EAPs not only have the right people like you on the phone, able to provide that immediate support to HR, but then also being able to really work with the organization, right? To decide, okay, how are we communicating with other employees? What is our strategy going forward? How are we handling this manager who's her husband, right? And is still an employee with us. All of these things that are so critical and yet are, not anything that, an HR person is expecting to have to manage. Even just the fact that she was able to get you so quickly and that she was able to speak to someone who know the organization, right? And I think that's another really important question to ask, is that in these crisis moments, first of all, is it 24/7 support? And then are you speaking to someone who is a member of your account team, or are you speaking to a representative who is maybe handling crises but doesn't actually know your organization? So really important points to consider.
Yeah. And you're so right about access. It needs to be 24/7. And you mentioned our account executives, they do a lot of the consultation because we mentioned HR, their heart's racing. They're not thinking as clearly. They don't want to call an 800 number. They just want to say, okay, I need to call Veronica to help with this matter. And,
Right.
Veronica might have to quarterback it and bring some other people into the conversation, but the company knows immediately where to turn and they trust the individual they're calling.
Exactly. Yeah. That's huge.
I want to point out just how financially impactful these cases can be, because so often we hear companies wanting to reduce, that medical spend or that behavioral health spend, which obviously is important. You want to maximize your benefits and your benefit dollars, but there's a lot of misunderstanding about how these crisis moments can impact a company.
Yeah, Mark. And, just speaking from a financial impact with domestic violence victims, research has shown that as a group, they miss about 8 million collective days of paid work per year and cost employers around $1.8 billion in lost productivity.
Yeah, that you also have those indirect costs of decreased productivity from other workers and brand reputation and risks that come up with this, and the public relations and crisis management. So let's talk a little bit about what companies and benefits consultants, what they can do when they're, kicking the tires on EAPs, when they're vetting potential vendor partners. What should they be asking and looking for? How can they do their due diligence to make sure EAPs can support companies through crisis events?
Yeah, it's such an important question. And I think one thing that I would do in that situation is to ask for case examples. Can you give us some examples of, crisis situations that you've handled? And really like getting into the details, like who's answering the phone? What time is it? Is there a difference between weekends and working hours, right? And I also really like to pay attention to not just the immediate response, although that's certainly very important, but also what is the follow-up like? And, in this case example that you shared, this employee had already done all the research and she'd found the domestic violence shelter, she had her documents, but oftentimes people haven't done that, right? HR might be their first stop. And so in those cases, not just the immediate crisis, but all of those other elements. How are we making sure she has what she needs? Does she have, right, money for food? All these different components. And that's really important as well.
Yeah, absolutely. And I love that first thing you said about case examples, because that gives you a lot of opportunities to dig in. Who was the clinician working this case? Are they, part of your staff, or are they part of a vendor partner you use for these services, which ties into, how much control do you have over your clinical staff?
Exactly.
What's the turnover of those individuals? Because again, it's not just their clinicians. They need to be trained how to specifically do this to work within the boundaries of employment law in the US here.
That's right. Yeah, that's a good point.
So it's a next level of education after getting your master's and getting your license. So how often are your staff turning over? How often are you trying to train these people to do this very specialized work?
Right. Which also speaks to what level of support are they receiving? What kind of ongoing training? Who is around when they're working, especially if it's, after hours, for even with some companies are 24/7 operations, right? So if it's, 11 o'clock at night, who else is around to support the clinician on the phone?
Yes, absolutely. So that's for, during kind of the RFP process when you're vetting EAPs. These are the questions to ask. But Zoe, let's say an organization has selected an EAP. How would you recommend that company maximize this part of EAP services?
Yeah, it's a great question, because it's one thing to have it, but then how do we really, get the most out of it? And I think that continuous training is one of the best things that an organization can do to make sure that the EAP is continuing to provide training for managers on, how to identify potential warning signs of mental health, substance misuse issues in the workplace, what to do if they spot something, if an employee comes to them with a concern, so that they really feel empowered to reach out to the EAP and that they know how to reach them, right? And who they'll speak to. And sometimes it's encouraging them too, just to get more familiar with using it when it's not a crisis. Hey, I'm a manager with this department. I'd just like to learn a little bit more about the resources that you can provide.
Well, Zoe, I think we have given our listeners enough to think about this month when it comes to crisis events and how EAPs can support them. So we will end it here. And we appreciate everybody listening to CCA's Beyond the Benefits podcast. Check us out next month. And until then, take care and be well, everybody.
Thanks, Mark. Thanks, everyone.